Diabetes is a complex condition that can have significant impacts on a person's overall health and well-being. The condition affects millions of people around the world, and it is projected to affect 700 million people globally by 2045. One of the key challenges with diabetes is that it often goes undiagnosed for long periods of time. This is because the symptoms of diabetes can be subtle or easily mistaken for other health issues. Common symptoms of diabetes include frequent urination, increased thirst, blurred vision, fatigue, slow healing of cuts and bruises, and numbness or tingling in the hands and feet. In some cases, people with diabetes may not experience any symptoms at all. Because of this, it's important to be aware of the risk factors for diabetes, which include being overweight or obese, having a family history of diabetes, being over the age of 45, being physically inactive, and having certain medical conditions such as high blood pressure and high cholesterol. Diabetes is a chronic medical condition that occurs when your body cannot properly process glucose, which is the primary source of energy for your body's cells. Glucose comes from the foods you eat and is carried by your blood to your cells. However, in order for your cells to use glucose as fuel, your body needs insulin, a hormone that is produced by the pancreas. In people with diabetes, the pancreas either produces little to no insulin, or the body is unable to properly use the insulin that is produced. As a result, glucose builds up in the bloodstream, leading to high blood sugar levels, which can cause a wide range of health problems over time. There are several different types of diabetes, but the most common are type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system attacks and destroys the cells in the pancreas that produce insulin. This type of diabetes typically develops in childhood or adolescence, and people with type 1 diabetes require daily insulin injections to survive. Type 2 diabetes, on the other hand, is a metabolic disorder that is often associated with lifestyle factors such as obesity and physical inactivity. In type 2 diabetes, the body becomes resistant to insulin, and the pancreas may not produce enough insulin to meet the body's needs. This type of diabetes is much more common than type 1 diabetes and can often be managed with lifestyle changes such as a healthy diet and regular exercise, as well as medications and/or insulin therapy. If you are at risk for diabetes or have concerns about your blood sugar levels, your healthcare provider can perform a simple blood test called an A1C test to check your average blood sugar levels over the past 3 months. If the test indicates that you have high blood sugar levels, your healthcare provider may recommend additional tests to help finalizing the diagnosis. Once diagnosed with diabetes, managing the condition becomes critical in order to prevent long-term complications such as heart disease, kidney damage, nerve damage, and blindness. This typically involves regular monitoring of blood sugar levels, taking medications or insulin as prescribed. But what else? Number 1. Instead of trying out different fad diets such as keto and paleo as most people regain weight once they stop, it's better to adopt a healthy dietary pattern that can be maintained in the long run. The Mediterranean and DASH diets are good options. People with diabetes should avoid sugary drinks and reduce the consumption of desserts, sweets, and fatty foods. Eating high-fiber carbohydrates such as whole wheat bread and brown rice is recommended. Number 2. Sleep problems have been linked to obesity and diabetes risk. Altered sleep patterns can affect blood sugar control, and obstructive sleep apnea is a frequent cause of disrupted sleep. Obstructive sleep apnea is more common in people with diabetes, especially those who have obesity. The hallmark symptoms of sleep apnea are loud snoring, snorts and gasps during sleep, and daytime sleepiness despite a full night's sleep. Anyone experiencing these symptoms should be evaluated for sleep apnea and consider a home-based test. Number 3. For people who are overweight, metformin, a commonly prescribed drug for lowering blood sugar, can result in modest weight loss of about 5 pounds on average. However, larger weight losses have even more significant benefits in improving diabetes and its complications. A relatively new diabetes drug, semaglutide, Ozempic, can help people shed up to 15 to 20 pounds, respectively, while also lowering hemoglobin A1C levels by as much as 2 percentage points. Number 4. Exercise should be done safely, especially for people with diabetes who may experience neuropathy. Walking is an ideal exercise for most people, but it's important to start slowly and increase distance and speed gradually. People with diabetes should pay special attention to their feet, wearing well-fitting shoes and checking for any redness, blisters, or sores, as neuropathy can cause numbness, which makes it difficult to sense injuries. Number 5. Know your treatment target, including an A1C of 7% or less to reduce the risk of complications such as vision and kidney problems and neuropathy. Diabetes also increases the risk of heart disease, so it is important to aim for a blood pressure of less than 130/80 mmHg and an LDL cholesterol level reaching 70 mg per deciliter or lower. It's important to note that diabetes is a complex condition, and everyone's experience with diabetes is unique. If you have concerns about your blood sugar levels or think you may be at risk for diabetes, it's important to speak with your healthcare provider. They can help you determine your risk factors, provide advice on how to prevent diabetes or manage your condition, and connect you with resources and support as needed. Thanks for watching. If you enjoyed this video, please give it a thumbs up and subscribe to our channel for more great content. Don't forget to click the notification bell so you never miss an upload.